Healthcare across Maine and the nation is in crisis. Those are the alarming words of Nathan Howell, the president and CEO of MaineGeneral Health. 250 doctors serve patients from 88 cities and towns in central Maine. Its two largest hospitals are in Augusta and Waterville. This week, Howell announced that MaineGeneral will cease a major part of its mental health services for children and minors.
On May 16, it is shutting down the PrEP program and other psychological services. PrEP is the Pediatric Rapid Evaluation Program. It provides services to children who have recently been placed in the foster care system. Good evening, I'm Chris Costa.
And I'm Amanda Hill. Joining us this half hour to talk about the impact and possible solutions is Betsy Sweet, an advocate for mental health groups in Maine. Betsy, you know this issue well. So let's start with the impact that this will have. How big is this and who's getting left behind in this?
So who's getting left behind are the most vulnerable kids, right? These are kids in foster care, so they're already in trouble. They're already having to have a lot of extra challenges. Many of them have mental health diagnoses. But what this program does is actually provide a diagnosis for these kids quickly, right? The rapid, right? So basically, if there's no diagnosis, then the children can't receive services. So what we're seeing is this elimination of this big piece. So this leaves a huge service deficit and a huge problem for young people, for these young people and their families and their foster parents about they have needs, they can't get a diagnosis anywhere in central Maine, and so then they can't get services. So it backs it up, and again, these are some of the most vulnerable kids that we have in our state.
You have kind of touched on this point already just a moment ago. We know the state is struggling to manage its foster care system, but it seems like cutting this key mental health program for the kids in the foster care system, it seems almost punitive to the kids and their foster families.
Yeah, it is very hard. And again, it's not the state cutting it. It's the hospital saying, we can't afford to do this. Between insurance claims, denials, between the low rate of reimbursement for this mental health service, and frankly, all of our mental health services, we are seeing providers, not just MaineGeneral. I mean, I worry that this is the house of cards, right? So this is going to come out and then it's already starting to crumble. This is a acceleration of that. So, and again, it creates what we call service desert. So nobody, think of it, Augusta, Waterville, those areas, that diagnosis is missing. So it's really a problem.
You were saying to us right before we started the 5:30 that if a big hospital like this that makes theoretically should make lots of money is having this problem, that there are smaller agencies that kids rely on that are also going to be impacted far worse. Can you explain?
Yeah, so hospitals get paid a little more for the reimbursement for their services. Community provider agencies, which is where most kids get the best service, where they are closest to their families, where are absolutely struggling.
Just to clarify, that's like a spur wing or a suites or residential facility,
or kids piece, and we've lost 240 beds in the last couple of years for residential services. So these are kids that are in so much trouble that their families can't help them. They need to be in residential care for a short period of time. So we have empty beds because we can't pay enough money to staff those beds. So that creates, so where are those kids end up? Well, they end up in the hospital, and then when they're older, they end up in jails and on the streets and homeless. So it's a domino effect. We have to get serious about using resources, even though they're limited, in this prevention. And this is early prevention to get diagnosis, because the cost and the impact and the trauma to those kids just grows.
Well, I want to talk about the state's obligation here really quickly, because the CEO of MaineGeneral said they can't afford to keep doing this. They said state reimbursements don't cover the cost of care, excessive insurance denials, and increased costs of doing business. What is the state's obligation here?
Well, interestingly, the state has been sued by the Department of Justice before this to say you're not doing enough, you're not putting enough money in. And the hard part is that the state has been trying in the last couple of years to increase its mental health reimbursements. The problem is we were so far behind that investment doesn't even bring us up to baseline. So it is a lot, and we have to start saying, what's a priority here? What's a priority here in Maine? And if we look at, yes, money's tight, we know money's tight all over, but we are spending money. We're spending money on tax breaks. We're spending money on things that help people who could do without. And these poor kids and their families, I don't mean poor economically, but that too, but these kids who need so much help are at the short end of the stick. And it seems to me that the state's obligation right? Wasn't Eisenhower who said, it's how we take care of our least of us is the measure of a government. And so we have to just say, yeah, it hurts, yeah, it's hard, but we're going to buck up and do it. And also this, right now, the legislature has several proposals that don't cost a thing, that would unblock the bottleneck for employees, for getting more people certified,
Right.
for getting teams
Right.
take care of kids. There's a lot of stuff they can do for either low or no cost that would really help this kind of bottleneck.
So we'll be following this for a while.
I'll be there to help you.
Betsy Sweet, thank you for joining us.
Thank you so much for covering it.